There are multiple benefits when it comes to talking about implant dentistry. One of the things that I can say to patients when, let's say, if it's as simple as missing a single tooth, there's multiple options to replacing that tooth, whether we want to just leave the space, because if we want to have a tooth extracted and a patient's not interested in replacing that space, it's definitely an option. I try to guide patients into something that's going to be better for them, because there's a lot of side effects or a lot of contraindications to not doing anything about that space, whether it involves teeth moving or being future sites of food impaction and causing issues to other surrounding teeth in the area. But to this day, the best way to restore or replace a missing tooth is going to be a dental implant for multiple reasons. One, we don't have to touch the adjacent teeth. So the other option would be potentially to do a bridge, but in order to do a bridge, we'd have to compromise the structure of the surrounding teeth. And bridges are usually only good for, on average, about 10 years. So eventually, at some point in time, something might happen and a failure might occur. And if that bridge does fail, well, now we might ruin another tooth next to the site and now have an empty space for 2 teeth. So that's one of the benefits to replacing it with an implant. We don't have to touch the adjacent teeth or the neighboring teeth. The other benefit is an implant actually replaces the root form of the tooth that's missing. So once the implant's placed into the jaw, the implant is healed, the surrounding bone and the surrounding tissues of that patient are healed, functioning adequately. That implant will now stimulate bone and maintain bone in that area to prevent future resorption of any bone. So in an essence, an implant, what it will do is maintain that person's proper anatomical jaw structure.